So at this point, I want to invite the president of GACOPA, Mr. Austin Odur. Please welcome.
Thank you so much, all the delegates who are present here, and thank you, the Director General of Rwanda Ministry of Health, for accepting our invitation to officially open this function. And the registrars given a clear roadmap of what has brought us here. And as GACOPA, we are also happy that we are taking part in this history, because this is history that is being made. So I will only take something like 5 minutes. I will quickly read through this speech that I had for you people. This is the speech from the President of the Global Association of Clinical Officers and Physician Associates, delivered today in this historic first East Africa Clinical Officers Harmonization Workshop held here at the Lebanon Hotel. So to the Director General, Quality and Standards, Dr. Jean-Baptiste, representing the Minister for Health, distinguished guests, all the regulatory bodies, the key people in the clinical medicine field, all protocols observed. Ladies and gentlemen, good morning. Yeah, I am Austin Odur. I am a clinical officer by profession and practicing dermatovenerologist. To be precise, currently I'm attached at the Migori County Referral Hospital in the Republic of Kenya. Today I stand before you, ladies and gentlemen, to address you in my capacity as the President of the Global Association of Clinical Officers and Physician Associates, that's GACOPA, as an organization that prides itself in pursuing seamless operations within an evolving healthcare landscape and fulfilling the growing demands for quality health services through the establishment of standardized guidelines for the proper training and licensing of healthcare workers. I found this workshop for the harmonization of training practices and licensing within East African community through a collaborative approach. I could not have come at a better time. It is an honor to address this workshop organized pursuant to the resolutions of the 23rd Ordinary Meeting of the East Africa Community Sectoral Council of Ministers of Health. This meeting sought to address the stalled harmonization processes for the allied health professionals, pharmacists, nurses, midwives, clinical officers across the East African community. As a matter of utmost importance, the regulation of healthcare practices across our member states is paramount. Further, our pursuit of regional integration and harmonization requires that we recognize the critical role of healthcare in fostering the well-being and prosperity of our citizens. Healthcare knows no borders. Diseases, pandemics, and health crises transcend geopolitical boundaries. As such, it is incumbent upon us to forge a collaborative framework for the regulation of healthcare practices that transcends national frontiers. However, the lack of harmonization in healthcare regulation across our member states presents significant challenges, and there are disparities in standards, qualification, and licensing requirements, not only that these undermine the quality of care, but also impair the free movement of healthcare professionals within the region, just as the registrar had already stated. This fragmentation not only hampers the delivery of efficient healthcare services, but also jeopardizes patient safety and trust. We are the guardians of public health, as the DG stated, and we are entrusted with the responsibility to safeguard lives and promote the highest standards of care. Consequently, let us reaffirm our commitment to the well-being of patients and the public. Every decision we make and every regulation we enforce must be guided by this overarching principle. Therefore, I assert that our collective response must transcend borders leverage shared expertise and resources to mitigate health threats on a global scale. Together, we can enhance surveillance system, facilitate information sharing, and harmonize regulatory approaches to ensure a coordinated and effective response. To this extent, I urge the relevant stakeholders present here, especially now at the East Africa Council of Ministers, that we spearhead efforts towards the establishment of a unified and harmonized regulatory framework for healthcare practice across the East African community. Such a framework should be built upon the principles of equity, transparency, and mutual recognition of qualifications. By harmonizing standards and streamlining training and licensing processes, we can facilitate the mobility of healthcare professionals, enhance the quality of care, and promote cross-border healthcare collaboration. Moreover, a unified regulatory system will bolster public confidence in healthcare services across the region, fostering a conducive environment for investment and innovation in this sector. In forging this collective approach to healthcare regulation, we must also prioritize the protection of patients' rights and interests. Robust mechanisms for oversight, accountability, and recourse must be integral components of our regulatory framework. Ensure that the highest standards of ethics and professionalism are also upheld across the region. Together, we have the power to shape a healthcare ecosystem that is safer, more equitable, and more resilient than ever before. In conclusion, the time is ripe for East Africa community to take bold strides towards harmonizing healthcare regulation across our member states. Let us seize this opportunity to safeguard health and well-being of our citizens, strengthen regional integration, and build a healthier, more prosperous future for all. I thank you.